Welcome to the office.
And what are you doing down in Florida now?
I live there. I live in Key West.
What do you do?
I have my little business.
Okay. You want to get back to work?
I would love to. If I can go back to work and live so much normal life,
Okay.
that'd be great because I've been on the floor for a year doing my stretches and
Okay.
I'm done with this.
Let's get to work then. Let's go over your x-rays.
Okay.
As I'm going through this, Elena, if you have any questions,
Sure.
you ask.
Sure.
If you're uncomfortable with anything I'm doing, you stop me.
Sure.
Okay? You have a seat over here. We're going to go over your films. And as we start to put things together, it should make some sense, okay? This is a picture in time map. This tells me how you've evolved from birth. And you've heard me talk about this. You've watched videos. There are 24 bones in the spine, 23 discs in between. We have 24 movable bones. And I want you to think of this as a 24-story building. This is the foundation of your 24-story building. So the first thing I want to go over is this x-ray, okay? And we can also see there's a lot of digestion stuff going on here.
Yeah.
Okay? And that could also be part of what was contributing to what you had. Okay? Let's look at the foundation first and let's see. Yes, right leg is shorter than the left. And here's something that is kind of evident to me. Your sacrum is actually bent here. It's bending from here to the right side. Okay? Let's go to the numbers and see. This should make some sense. So when we're looking at this, okay, PI1, IN2, left side of the sacrum, there's no rotation of your sacrum here today. The right leg is 9 millimeters shorter on the right side. The measured difference is what's measured. If correction of the pelvis will keep it the same. So it's not the pelvis that caused the short leg. But what I do see is this. The sacrum, 4 millimeters dropped on the right side. And that 4 contributes to this.
Mm-hmm.
Okay? So 4 of this is coming from the sacrum. However, let's go to the side here and let's see. I have a suspicion you actually had it, but because you were so active, you didn't notice it. Mm-hmm. I have that suspicion. The reason why is this. This part is smooth. Look, that's
mm-hmm.
nice. That's the nub right there. Okay?
Mm-hmm.
That's down in S3, S4.
Mm-hmm.
Let's go down to the coccyx. Coccyx is a little bit open there. Okay, let's zoom in. It's so tiny though. This part it's so tiny. Let's see okay, so if we do it this way, that's 1, 2, 3, 4, 5. Maybe. There's a little opening there. That's fine. This is open a tiny bit at the bottom. It's tiny though, but it could be enough to cause what's going on. I see it more here though. Do you see this part here? Let's change this. Yeah, now you can see it. It's bent right there. Mm-hmm. Okay. It's more S4, S5 is where I would probably start with you, and I have to find it on you as well. Okay. Your hip sockets are good, ma'am. I'm happy with that. We are dropped on that right side. And because we're dropped on that right side, it's throwing off the imbalance. Now, here's what's interesting in your case, and this is a good example. We talk about this in the Gonstead work, and it's also in the chapters. And when is a heel lift indicated? And 2 of the criteria or 2 contraindications to putting a heel lift. So your right side is dropped, yes. But the curvature, the lateral curve, I don't know if I call that scoliosis or not, but let's say lateral curve, is opposite the short leg. So it's not indicated to put a heel lift. If in the Gonstead work, if we put a heel lift, it makes this worse.
I noticed that if I put it, because I was playing with it, I put it on the left leg,
Yeah.
and it straightened everything up. But when I took it off, when I came home,
Yeah.
I got the pain in the right leg.
Interesting.
Like I couldn't even put
But
any
you
weight.
understand.
Yes.
You understand. In the chapters it talks about, in the Gonstead chapters it does talk about, so rotation and curvature. So when we're looking at this, the curvature is on this side. So here's how we explain it, okay? Like, so we're short on the right, but the curve is the opposite.
Right.
Curve is the opposite, it's down. If I bring this side up, it's going to make the curve worse.
Right.
If the curve was turned to the same side of the drop leg, then a heel lift would be indicated.
Right.
Okay. But as I said, there's a lot in terms of, if you allow me to go deep with you, you're here for a week.
Yeah.
Okay.
Well, I'm here for 2 weeks.
Okay. All right. Good. Good.
She
So
told
I
me
got a little
to.
time. Okay.
Yeah.
Good. No. Good. I will re-X-ray it towards the end. So we
Okay.
want to see what changes happen. It's not just I feel good.
Okay.
Okay. And we got to make sure I'm doing my job too, right?
Oh yeah.
Yeah. It's not just fun and games. Okay. So sacrum, we're good. We understand that. Sacrum.
Mm-hmm.
Yes. Okay. S4, S5. Coccyx we can look at later if it's there. I'll palpate, but that's not where I would start with you. Okay. Now let's continue on the lateral. Actually, let's go back here, and let's continue up. So yes, curvature. It comes back here. Did they check your bone density?
Yeah.
Little low.
Still closed.
Yeah, it's a little low bone density. So I don't know that I want to be working in this area. Okay. Because the bone density is a little bit low in that area, okay, in the upper lumbars. So we don't really want to mess around there. I'm okay with the tailbone. I'm okay with the tailbone. This area, I'm a little suspect. I'm okay with the digestion area. I'm okay with that area. I'm okay with the neck. I'm okay with the upper cervical. Your jaw is also off. You want me to deal with that while you're here too?
Yes, I would love to. That's from the dental surgery. I've been struggling. I mean, I had the whole damage, like this
Right
whole
side?
right side. My face was like hurting on touch. After that, they had me open up for like 5 hours straight.
Fair enough.
And that just did it.
Now you want the good news?
Yeah.
Your disc is beautiful. Good discs. L5, 4, 3. They're tilting a little bit, but they're good. Your discs are good. These discs are good. Let's look a little closer here now. So level, right there, open. That's open. That's level. That's open. That's open. Okay, Sam, you got a near textbook neck curve. You have a very nice neck curve as well. Okay, it's a textbook neck, normal. Do I see you had an injury there? Whatever it was, you had some whiplash. Okay, you had whiplash. Here's how we're going to determine the neck. Flexion, you remember how he did flex and extend. So this is neutral, this is going back in extension. When you go back in extension, it pinches a little, 2, 3, 4, 5. You get any shallow breathing?
Yeah.
Okay. All right. Now, let's go forward, inflection. And this is where we'll get a couple of answers. When we go forward, they should all move forward. That one didn't move forward. Okay. That one didn't move forward. Okay. That one didn't move forward. That one didn't really. None of them really moved forward. So when you're flexed, yeah, you lost the curve, but you're supposed to lose the curve. It should be more curved. Okay. And a lot of that is starting here, C7, T1 at the base. Okay. This is blocked here together. 6 is up. They're all kind of stuck. Okay. But could it be from this or is it? No,
that was from the pneumatrix.
Okay.
Because I couldn't. I mean, I still am like this side is forward. Okay. Like this part of the rib cage.
The right side.
The right side.
Let's look. Is it forward or does it feel forward? Let's see. Way. Your left side is higher. Your right side is lower. T1, T2, T3, T4, T5, T6. Well, your bones are rotated this way. So your right is forward.
Yeah.
Now where is it coming from? Let's hunt. Okay, is coming, this is rotated, this is rotated, this is rotated. Guess where it's all coming from?
Pelvis.
Sacrum.
Sacrum.
It's all coming from this drop.
Okay.
Shall we get ready?
Yeah.
You ready?
Yeah.
Shall we do it?
Yeah.
Let's watch you walk. Oh yeah, so it does this.
Yeah, and it makes the noises like the hips
In the
are
front,
making.
right?
Oh yeah, making noises.
Keep walking. Yeah, she's very stiff. You're very stiff. Have a seat.
Right.
Starting at the base. C7. So, as it was taught to me nutritionally, is osteoporosis starts as a digestion issue. This all goes back to your digestion, man.
Mm-hmm.
You know that, right?
Mm-hmm.
Base of the neck, C7. Mm. And it's sticking down all the way. Yep, all the way down to the sacrum. Okay. So I'm getting the base here, 7, and I'm getting sacrum down low, okay?
Mm-hmm.
For today.
Okay.
Nope, upper's good. Static palpation. Let's see, and we have a baseline to look at. I want you to see this posture, the overall appearance of the posture. And you can see the bumps, they disappear here, comes back here, got it there, disappears there. As we run our fingers down the spine, I'm pretty sure something is going to show up here at some point, okay? It's just not there today. And you can see the swelling go all the way down to where? The tailbone, right there. Let's check your pelvis and let's make sure the pelvis is moving. Feet together, open and close the knees. Feet are touching. Open and close the knees, please. Open, close, open, close, open. Right side only, open wide. So when she does the right, there's a little tinkle on the left side. Left side only. Right pelvis is fine. Right side only again. It's pulling from right down here, man. Right there. Scoot back for me, please. Okay, so let's test this out now, okay? Nice and easy there. This is number 5. Come back towards me. That's okay.
It's just, it's actually,
You
hurts like right.
You get it
Right
in the tail.
there.
Okay,
I get it like right in there.
got it. And she's pointing to the inside of the SI joint of the toe at the sacrum. L5, lean with your back, not your neck. S1, S2, S3.
Oh yeah.
Oh! Ah! S4, S3.
Ah!
Okay. S3.
Sorry.
That's okay. You're allowed to yell. It's okay. Just don't hurt me with those nails.
No,
lady.
I
That's all
won't.
I'm saying.
You're just afraid of my nails.
What's that? My mama had long nails like that, but she had them rounded, not pointy.
Well,
Yeah.
I just changed the shape.
With the rhinestones and all that fancy stuff she used to do. God bless her. All right. Seven. Let's check the movement. Sit back for me, please. Okay. Base of the neck. 7. 7. 1. 7 to the right hand.
Ow.
That's not moving. 7. 6. 5. 4. 3.
That was a little.
Yeah. 2. But there's it's more hypermobile up top here, okay?
Right.
This is all coming from 7. Turn left, turn right. Yeah. Look up. This is isolating the lower cervical. Turn left. That's right. Head down, left, right. So inflection, it's the upper cervical. This is C7, S3. Okay, I'll do C7, I'll do S3, and I'll work on your ankles today. That's where I want to start with you. And I'm going to start lightly on your C7 here. It is stuck quite a bit on the right side, okay? I'm going to start it on the left just to get it going, and then we're going to go on the high-low for your sake. Okay? C7. Now, let's put the seatbelt on. Right hand up. That's and down. Okay, hands at palms up, resting on your thighs right there. Good. Excellent. Left ear down, and I just want to set it up, just like that. Nice and easy. That wasn't so bad, was
No,
it?
it was not.
Very nice. Let's go
Wow.
face. Tell me.
Wow.
What?
Difference.
Barely made a sound. though.
No. It's different.
Good.
Wow.
Face down over here. Down. Just a tiny bit more. That's the rest. Good. You okay?
Yep.
Good. Now's the sacrum. And by the way,
Oh.
we'll deal with the coccyx. You're here for 2 weeks, but that's not where we're going to start. 1, 2.
Hi.
Hi.
How you doing?
Okay.
All right.
S1, S2, S3. Okay. Now, we said that it's dropped on the right side. Yes?
Yes.
So we want to torque up. We want to bring it up. Are you okay with that now? There you go. Good. That's a little bit. You okay?
Yep.
Ooh, gotcha. Good. Thanks, Shasha.
Yeah.
Table, hold my hand, please. And walk a little bit for me. And as you're walking, actually just walk about 2-3 times.
Better.
A little different.
A lot different.
Keep walking.
Still hurts, right?
Sure.
Right. Yeah.
Just keep walking. Well, we're not, I don't see us, fixing it in 1-2 adjustments. You know it's a process.
I know.
You know it's a process. One more time, please. Now, when you're walking back, walk on your toes. Walk towards me and walk on your toes. Walk on your toes like you're wearing high heels. Good. You be
It's
wearing.
actually easier to walk on my toes than it is on both feet together.
4-inch or 6-inch heels. What do you wear?
I wear nothing.
What?
I wear little flats.
You don't wear heels?
Not anymore. My feet swell.
Well, what's nice is you could actually wear them now if you wanted to. Maybe we test it later.
Yeah.
Maybe you buy a pair of heels while you're here.
No, oh gosh.
Okay? Walk on your heels, please. So that's testing the sacral nerve, L5S1. This is L4, L5. No pain? Right butt? Okay, walk it off.
All this hurts there.
Okay, walk it off one last time. Regular walking. We'll be dealing with that with the buff and polish. We've got to break up all that scar tissue and the imbalance of the walk. Yeah? Okay, come back over here and have a seat. And let's retest first. Turn left, turn right.
Wow.
Look up, turn left, turn right.
Wow.
Look down, turn left. Nice.
Wow.
Nice. Now, let's check the bottom. I want to see the movement. Sit up straight. Come back slowly towards me. Not the head, please, just the back. Thank you. 5. S1. S2. You come back yourself, please. Come back all the way. Come back, come back, come back, come back. Nice. S3. I'm pushing harder. All the way back. You remember the ow?
Yep.
4. 3.
Wow.
No ow?
No.
Okay. Awesome.
No. Oh.
But no big, huge crack at the bottom either, right?
No.
Okay. Now, let's go on your back, please. Relax the legs. You're here now, okay? Good.
Both of them.
This is worse though. Yeah. So we're going to start with your right ankle today. We're working on the right ankle. And you said what now? It was bile duct cancer.
Bile duct cancer.
They removed the gallbladder, but your gallbladder was fine.
Well, fine.
But they had to move it because it was all connected.
It was connected.
Liver.
Oh.
Okay, can you handle it? Can you
I'm
feel it?
trying.
If it's too much, you tell me to stop, okay?
Well, remember my pain tolerance level is a little high. You know that.
You call your husband after we're done here, okay?
Yeah.
He's waiting for your call. 5, 4, 3, 2, 1. Right side. 5. How long you been in Florida?
27 years.
Nice. Nice. This side is good. This is an AS talus medial tilt right there. 5, 4, 3. Breathe through it, please. 2 and 1. Shasha. I need Shasha's help. I need your help again. Is that okay? All right. Boss, I need you to hold her tibia for me. Here, please. You want to grab, here, you can use this. So just grab from right about there, please, underneath. Good. Firm. Not keep it down and hold. I want your hands to be a little firm. Okay. On 3, 1, 2. That's a piece. You okay?
Yeah.
Let it go. That's it. Thank you. Let's use the board. Raise your right leg.
Moves.
Raise your right leg. Turn to your right side. Yellow. Relax the foot, bend it a little bit, please. There you go. Navicular. Navicular. On your back, please. You gotta do the cuboid bone. Straight, bend the knee. I'm on the cuboid, and the way I'm gonna sit is thumb paisy. Thumb paisy. There you go. Okay. Now, let's move the foot around. Circles.
Wow.
Look at her.
Wow, what difference.
Look at her,
Wow.
not me.
Wow.
Both of them. 4, 3, 2, 1. Relax. Good.
Still low.
A little bit.
Oh, sore.
But better. Bring your toes back as far as you can, all the way back. All good. Bring them back. Down. Different. We'll deal with those later, okay? Because we started on your foundation.
Okay.
I did the ankle. It was affecting your walk.
Okay.
I don't want to mess with the knees, as I said today, because of the foundation. We did C7. We did the S3. Your homework: water, walking, ice.
Ice where?
Tailbone and base of your neck, where I adjusted you.
Okay, twice a day.
Twice a day.
10 minutes.
10 minutes.
Okay.
Fair enough?
Fair enough.
Okay. I don't want to give you anything to take supplementally or any of that right now. You just eat. You like pineapple? Can you eat pineapple?
Okay.
Yeah?
I have lots of bananas and mangoes.
Can you eat pineapple?
Yeah, I can eat.
So I want you to eat the core of the pineapple. The power, the enzymatic power for anti-inflammatory properties. There's a product we use, an enzyme. It's a pineapple core base. So you cut the pineapple, eat it within 90 minutes of cutting it. The middle.
The middle?
Chew it. If you don't want to eat the fiber, it's okay. Chew it for 2 minutes, spit it out if you want.
Okay.
That's the power. I want you to start on that today.
Okay.
Like a fruit guy down the street, across the street, he sells the core. So you can ask him, can you cut one right now and you can give me the core right now?
How many of that should I eat?
Right now, do half a day, one a day if you can. The core,
The corn?
not the whole pineapple.
Alright.
You can eat the pineapple as well, but the core is the key for us.
Okay.
Okay. Let me do the work. Let me do the work. Relax the elbow. Down. How are the shoulders now? Move on.
Wow. Wow. I don't have scoliosis anymore.
Stand up, please. Stand up, please. Squeeze. I told you those nails. Squeeze. I told you. Squeeze. Good. Relax there. Elbow. Squeeze. Squeeze. Questions for me?
No, we'll see what tomorrow brings us.
I'll deal with your nose, your DV breathing.
Mm-hmm.
The nose is a little congested as well.
No, it's always been like on this side. I'm all swollen on this side. I get this swellings.
I will work on
red
that.
through here, and that started what 3-4 years ago when this whole ordeal, like the jaw was bugging me.
I'll work on the septum and the jaw. Let's not mess around because we want to see what this did, okay? But there is one more thing I gotta do. I forgot.
Be careful. I have little cyst and it's very painful.
Where?
Right here.
I won't touch it. Can I do the right side?
Yes. Well, you can do it, but just don't do the cyst.
Where's your cyst?
Right here at the base.
Let me see.
It's very painful.
Is that okay there? If I squeeze there?
Yeah.
I'll خلاص.
No.
I won't do it anymore.
Okay.
That was necessary.
Okay.
Okay. Rub it, make sure it's okay.
That's fine.
You good?
Yeah. Even this kind of disappeared. That bump disappeared. Where'd it go? Thank God.
Welcome to the office.